Thank you so much for coming. We have some very exciting news to share with you today regarding a new health and fitness program geared towards fighting childhood obesity in our community. It's a pleasure. This is a collaborative effort, and it's a pleasure to introduce some of our community partners. With us today, who will be speaking in a moment, is Mayor Parris with the City of Lancaster. We have Michelle Kiefer and George Giese from the AV Partners for Health. We have Roy Coombes, manager of the Wal-Mart in West Lancaster. And we have Dr. Armando de Leon from the Community Outreach and Engagement Center of UCLA. And at this time, it's my pleasure to introduce our mayor, Mayor Parris.
Thank you for coming. In the Antelope Valley today, we have about 80,000 children. 35,000 of them are obese. That is it's an appalling statistic. The reason for that is because what obesity leads to. We're going to have a wave of diabetes that has never been heard of before in the world. And it's going to start in the United States and it's going to spread throughout the world. The only thing that we can do is within the communities, within the neighborhoods, to put an end to that. It's not going to happen from Washington. It's not going to happen from the state. It's going to happen right here in the neighborhoods. And interestingly enough, UCLA, who is here, have done a tremendous amount of work on it. And it was just fortuitous we hooked up and got together. But I was down there meeting with them, and I was asking them, well, what works? And guess what works? Well, of course, we know exercise works. But how do you get kids to exercise? I know that when I was a kid, that's the last thing I wanted to do. But I was a little different. But anyway, it turns out that we have a tool called the Xbox that Microsoft put out that actually makes a profound difference. Kids will get on that machine, and you gotta really be careful that they don't stay on it too long. They get blisters on their feet. It actually has a definitive impact on getting rid of obesity in children. And so that's why we put 3 of them in the wellness homes, and we'll move them around. We're going to track the results, and I'm pretty positive what the results are going to be. And we'll see. And UCLA is here to help us with the statistics and the medical end of it, as they have been with everything else. And with that, I'm going to turn it over to Michelle Kiefer from Antelope Valley Partners for Health, who's actually going to administer it.
Well, thank you, Mayor Parris, and I was just told I was short, so I actually do have to move that down a little bit. And thank you to all of our partners. I want to especially thank Mayor Parris. He's donating 3 of the Xbox systems to us, and as he said, we will be rotating between all 5 wellness homes right now. The program's going to actually be a circuit training, including the Xbox Connects program, and then we'll also be doing standards, so to make sure that the children are meeting their presidential standards that are required to them for school. Also included in that, we'll be doing nutrition programs, label reading, how to make healthy snacks, just a whole array of things. We're planning on serving over 260 children through this program, and it will kick off in January officially. All 5 homes will have it, and we're really excited about this. This is where we start changing our health of the community. We really have to start with our children, and we're so excited about this, and we want to especially thank Kaiser, who funded this program for us, and we'll be hearing a few words from them. And thank you all so much for coming, and thanks again.
I'm so happy to be here to celebrate community health and how together we can all make a difference. That's key, together. Every day, Kaiser Permanente endeavors to expand access to medical care, share our knowledge and resources, and build healthier communities. Through a multitude of community benefit programs, we can do that, but that's only possible through partnerships with organizations such as Antelope Valley Partners for Health and the City of Lancaster and UCLA. All of us coming together are actually going to address this obesity epidemic. You know, we're dedicated to improving the health of people living and working in the communities we serve. And to accomplish our goals, we can only do this through providing funds to community organizations such as Antelope Valley Partners for Health. You know, we train doctors and nurses, and we pay for medical coverage for the uninsured, and we also promote wellness by sponsoring programs in the local communities that focus on prevention, healthy eating, exercise, and improving the environments in which we live and play. In addition, we promote volunteerism among our employees and physicians, and many of you know one of our most passionate and dedicated physicians, Dr. Philip Tuso, who is intimately involved in probably every project out here addressing the health of the community. And we do wish he could be here today, but unfortunately, he is busy seeing patients. So I'm here on behalf of Dr. Tuso, Dr. Cole, Linda Lawson, everyone from Kaiser Permanente. Now, Kaiser Permanente is proud to partner with the Antelope Valley Partners for Health and provide them with a grant to support Project Get Fit. As you can imagine, there is much competition for funding. Nonprofits are struggling to make ends meet, but Antelope Valley Partners for Health is doing a wonderful job bringing resources to the community and addressing the health of the community. The review process is rigorous because of the competition for funding for our community benefit grants. And we're always looking for programs that can be measured and can have a big impact on community health. As you may know, obesity is a key driver for chronic disease such as diabetes, cardiovascular disease, and stroke. Chronic disease is also a huge cost to the healthcare community. It's a huge driver. These diseases are preventative when we focus on eating healthy and getting physical activity. Project Get Fit is one of those programs which addresses the issue of obesity with youth and can help prevent such diseases. And Kaiser Permanente is proud to partner with all of you to support such an innovative program. Thank you.
I neglected to introduce Councilmember Ken Mann, who's also with us today. And standing next to him is a great community partner, Mr. Roy Coombes. He's the manager of the Westside Wal-Mart in Lancaster. Wal-Mart always steps up whenever there are community activities, community events, and just to give back to the community. They are a great partner, and we're very proud and honored to have them. Roy?
I just want to thank the city for allowing us again to help out in an important project. We're always willing to put forth effort to be a part of the community, and it's always great to see when what we're doing is actually making a big difference. So I thank you.
It is very exciting for us at UCLA to be able to partner with the city of Lancaster and to see such a great comprehensive team being brought together, you know, in benefit of the children of Lancaster, and just with the whole purpose of, you know, improving their quality of life over time. As you know, childhood obesity has tripled or nearly quadrupled over the last 30 years. We went from a 7% rate of obesity from children like between 6 and 18 years of age up to over 30% nowadays. And of course, we need to be on the lookout for all the problems and health issues that you know, are brought about by the overweight childhood obesity. Since it's this particular issue is just serving as a springboard to other chronic diseases, as was previously said here. The city of Lancaster and UCLA, through Mayor Parris here, we started working together some time ago through the National Children's Study, which UCLA is bringing, you know, to Los Angeles and Ventura counties. And as you know, the National Children's Study is the largest longitudinal study ever attempted in the United States. We are attempting to recruit over 100,000 families to participate, and the whole purpose is to precisely look into environmental influences on children's health and development. And of course, childhood obesity, overweight, diabetes, high cholesterol, asthma, all those things that are very, you know, common to not just children nowadays, but also adults, definitely interest us. And working with the city of Lancaster is definitely going to be, you know, very exciting, and we are happy to see that the entire community is very interested in participating and really improve the children's quality of life. Thank you. Thank you very much.
You know, when we first started addressing this issue from the city's point of view, it had never been an issue for the city, you know, the city government and the city staff. We were it was falling on deaf ears. You know, we would talk to the county, we'd talk to different places, and then all of a sudden, Kaiser got involved, UCLA got involved, AV Partners for Health just exploded, the county got involved, and there's the recognition that all of us working together can really do something for a limited cost. I mean, the cost of these games are, because Wal-Mart stepped up, they're $200 a piece, $600 we can affect 250 kids and actually keep them out of the hospital. It's just truly amazing what we can do when we work together and just do it. I mean, we just don't let money get in the way. We find a way to do it regardless of what the resources are. And the next time I have you here, we're going to tell you about an asthma program that's going to be truly innovative, one of the first in the world. And so every day we're getting more and more involved in this problem of we have a really sick community in some of these neighborhoods. And it's time we address it, time we look at it. We can't turn away from it. We have one neighborhood where over 76% of the households have somebody with diabetes in them. I mean, think about that, 76%. This is a sick, sick neighborhood, and we've ignored it for too long. And I'm just incredibly proud of the staff and incredibly proud of these people for not ignoring it and figuring out a way to fix it. Thank you.